Hello everybody, Dr. Jeff Lynch here with McKinney and this is Dental Implant Talk. Today I'm going to answer the question, why might I need a dental implant? Well, a dental implant replaces one or multiple teeth. It serves as the foundation of a new tooth. So why do people lose teeth to begin with? Well, there's a couple reasons. One, sometimes the cavity is just so big that we can't repair a tooth. Sometimes these big cavities will cause infections that are not repairable. Other times there may be a crack or a fracture in a tooth that makes it so we can't fix the tooth. And sometimes people are in a financial situation that they just can't afford to fix a problem tooth and they opt to have it removed instead. So what are the effects of losing a tooth and not replacing it? Well, these things affect the function, stability, and the aesthetics. The function makes it so you can't chew as well when you lose a tooth. Stability, your neighboring teeth are going to drift into that space. That's going to mess your bite up even more, and that's going to cause more wear and tear on the remaining teeth, possibly even leading to more tooth loss. Aesthetics is an obvious one. When you've got a big gap, you're not going to be as comfortable smiling. Some people are going to hide their smile or hide their mouth when they're laughing. It's going to affect your confidence and it's going to affect your self-esteem. Ultimately, all these things lead to affecting your quality of life. So losing a tooth can definitely be detrimental to the quality of life. So what does an implant do? How do we replace teeth? So let's talk about some individual circumstances. An implant, this is a large-scale model, can replace an individual tooth. The implant itself can replace the root. Then we build an abutment and a crown on top of it. We end up with a tooth that looks like a tooth, works like a tooth, feels like a tooth, and you clean it like a regular tooth. So what if somebody doesn't have any teeth? How can implants help there? Well, a denture can be attached to implants. There's implants in this model. A denture replaces all the teeth. This is acrylic and plastic. Without any implants, it gets in, it moves around. But with implants, we can snap it down to the jaw. All right? This creates way more stability, more comfort, better chewing ability, a lot better confidence and self-esteem. The top of the line when you don't have teeth is a bridge. This is permanently attached. It's screwed onto the implants. Patients never remove it. Works like regular teeth, look like regular teeth. Beautiful, solid, long-lasting. So those are some reasons that you might need dental implants. Hope that answers your question. Look forward to seeing you at McKinney